Hi everyone, welcome back. I'm Jin Su. This is the second part of the session, and I will explain the routes of medication, the medication orders, and the safety of administered medication to you. Nurses give medication according to doctors' medication orders. Let's see what the medication orders are. In China, doctors usually determine the patient's medication needs and order medications. Usually, the order is written. For verb orders, the nurse must follow the policy of the hospitals. There are several types of medication orders. First, a start order, which means that the medication is to be given immediately and only once. For example, epinephrine 1 mg IV start. The single order or one-time order is for medication to be given once at a specified time. For example, diazepam 10 mg at bedtime before surgery. The standing order may or may not have a termination date until an order is written to cancel it, or it may be carried out for a specified number of days. For example, amoxicillin 500 mg TID oral for 5 days. A PRN order, or as needed order, permits the nurse to give a medication when, in the nurse's judgment, the patient requires it. For example, Amphagel 5 ml PRN. The nurse must use good judgment about when the medication is needed and when it can be safely administered. Please check the common abbreviation used in the doctor's order on this slide. Now, let's get to know the routes of administration. Oral administration. In oral administration, the drug is swallowed. Because the skin is not broken as it is for an injection, oral administration is also a safe method. The major disadvantages can include an unpleasant taste of the drugs, irritation of the gastric mucosa, slow absorption, etc. In sublingual administration, a drug is placed under the tongue, where it dissolves. Drug can be sublingually administered for local effect. It is more potent than oral route because drug directly enters the blood and bypasses the liver. For example, nitroglycerin is usually sublingually administered to introduce a quick effect for angina pectoris. The injection routes. Because it breaks skin barrier, the sterile technique is needed when injecting the medication to patients. There are several types of injection administration, such as subcutaneous, intradermal, intramuscular, and intravenous. We will explain injection administration in details in the following sessions. Inhalation route introduces drug throughout respiratory tract for rapid localized relief. Other routes, such as rectal, topical, vaginal administration, can provide a local effect of disease treatment. When administering medication, the most important part is the safety. Nurses who administer medications are responsible for their own actions. The principles for medication safety are First, question any order that is illegible or that you consider incorrect. Call the person who prescribed the medication for clarification. Be knowledgeable about the medications you administer. You need to know why the patient is receiving the medication. Look up the necessary information if you are not familiar with the medication. Keep controlled substances in a locked place. Use only medications that are in a clearly labeled container. Do not use liquid medications that are cloudy or with changed color. Calculate drug doses accurately. Ask another nurse to double-check your calculations if needed. Before administering a medication, identify the patient correctly using the appropriate methods of identification, such as checking the identification wristband. Review medical history, energy, assessment, and laboratory data that may influence drug administration. When a medication is omitted for any reason, record the fact together with the reason. When a medication error is made, report it immediately to the nurse in charge, the primary care provider, or both. Always check a medication's expiration date. In China, conventionally, 3 check and 7 write is emphasized when administering the medication. 3 check indicates that when preparing the medication, before giving the medication to the patient, and after medication administration, nurses must make sure 3 times about being right of patient's name, bed number, drug's name, dose, concentrate, administration route, and time. In addition, now 8 writes are recommended in many facilities. They are: write patient, check name on the order and the patient. Use 2 identifiers. Ask a patient to identify himself. When available, use technology, for example, barcode system. Write medication. Check the medication label, check the order. Write dose. Check the order, confirm appropriateness of the dose using a current drug reference. If necessary, calculate the dose and have another nurse calculate the dose as well. Write route. Again, check the order and appropriateness of the route ordered. Confirm that the patient can take or receive the medication by the ordered route. Write time. Check the frequency of the ordered medication. Double-check that you are giving the ordered dose at the correct time. Confirm when the last dose was given. Write documentation. Document the administration after giving the ordered medication. Chart the time, route, and any other specific information as necessary. For example, the site of an injection or any laboratory value or vital signs that needed to be checked before giving the drug. Write reason. Confirm the rationale for the ordered medication. What is the patient's history? Why is he taking this medication? Revisit the reasons for long-term medication use. Write response. Make sure that drug led to the desired effect. If an antihypertensive was given, has his blood pressure improved? Does the patient verbalize improvement in depression while on an antidepressant? Be sure to document your monitoring of the patient and any other nursing interventions that are applicable. In this session, I briefly introduced the medication orders, the administration routes, and the most important for nurses, the safety of medication administration. Thank you for joining us. See you next time.